Hi everyone, this is Dr. Surakshit, pediatrician. Smile, cheese. Okay, why am I using these terms which I used in photography today? Yes, because behind a good smile there lies a healthy teeth within. So, yes, you guessed it right. Today we'll be talking on the topic teething in children. If you're not subscribed to this channel or if you're watching this video for the first time, do subscribe for more updates pertaining to child health issues on this channel. So let's see what we will be talking today about this topic. First thing about the timing of teething. The next will be the problems faced by the children during teething, and then the solutions to it, and what time should we start to brush the teeth of our children. So coming to the first point, we'll see. So usually the first set of teeth that erupts is called as primary teeth or the deciduous teeth or also the milk teeth, which is called. So the second set that comes usually are called as the permanent teeth. There are 20 primary teeth and 32 permanent teeth. The first primary teeth or the milk teeth that will erupt will be around 6 months of age. So the 20 teeth will start to erupt from 6 months up to 36 months or 3 years. So by the age of 3, the child will have all the 20 milk teeth or the primary set of teeth. So this is a rough timing. So it can be 1 or 2 months either side. So we will see what is also called as first we'll see other things like the timing which I have told you. So what are the sets of teeth which we see in the primary series? So we can see the incisors, 8 incisors, and we can see 4 canines, 4 molars, the first molar and the second molar. So coming to the timing, so first we'll see the lower jaw. As you can see in this chart, the central incisors of the lower jaw will erupt at around 6 to 10 months of age. Then the lateral incisors which erupts around 10 to 16 months. Then we have the first molar which erupts around 14 to 18 months. Then we have the canine which erupts around 17 to 23 months. And then we have the second molar which erupts at around 23 to 31 months. So now we will see the upper jaw teeth. That will also the same thing. The central incisors 8 to 12 months around, lateral incisors is around 9 to 12 months, then comes the first molar from 13 to 19 months, and the canines from around 16 to 22 months, and then the second molar from 25 to 33 months. So by the age of 36 months, the primary set of teeth would have erupted. So then what is called as delayed dentition? When we say it as a delayed dentition is when the child doesn't have any tooth erupted by the age of 12 months, or to be precise 13 months, or if the child doesn't have any teeth. So there might be various reasons for it, like local, systemic or genetic, which I will not be going in detail in this video. So if the child doesn't have any tooth erupted by 12 months of age, you have to consult your pediatrician to look into the cause. So what are the problems faced during this process of teething? So first, as the teeth erupts, it has to come through the soft gums. So during this process, the child will feel the pain. Because of this pain, child will be irritable, child will cry a lot, child will be a little fussy. Usually this happens during this time. And then the child might even have drooling of saliva, which is seen at this time. And child might also rub its cheek and ear due to the pain. Then other things which happens during this process like fever, diarrhea, cough or cold, which we usually attribute to the teething process. So there are various studies about this that has taken place, and they say that during the process of teething, the child never gets a temperature more than 100.4 Fahrenheit. So if the child has running temperature of more than 100.4, 101, 102, the child might have certain infections which is caused to virus or bacteria, because the chances of infection during this time will be very high. because the child puts everything, whatever the child gets during this time, to its mouth. So because of this, the chances of infection will be very high. So it's better to consult a pediatrician if the child runs temperature, if the child has diarrhea, if the child has cough, cold during this time. So coming to the next thing, what best we can do to soothe the child during this time. So the child will be irritable, as I told, child will be crying, child will be a little fussy. So we should continue the breastfeeding at this time, which is a major source of nutrition to the child, and also the child feels better when breastfed during this time. And also the love and care should be continued. And other things which we can do. So one thing is that we can wash our hands and with the finger just gently massage the gums. So that will also relieve the pain to a certain extent. Or else we can take a cloth dipped in cold water, and even that we can massage the gums. Even that will cause a certain relief in pain. Other things which we can do is you can use the popsicles made out of fruits, or you can use the carrot which is kept in freezer. So you can press it over the gums or keep it over there so that the child gets relieved a bit. You can also distract your child so that the child doesn't feel that pain, or the child doesn't cry a lot, make fuss a lot about the pain. Other things which we can do is teethers which we get. So this plastic teethers which we used to get before are not recommended to be used, but we get wooden teethers which we can use, like it will be in the shape of bangle as we can see here, or a stick, so or a necklace like. So this can be given to the child so that it puts into the mouth and it chews that, so that the child get relieved a bit of pain. And even you can wash that wooden teethers whichever you have and give it back to the child, so that the chances of infection will be very minimal. So the next we'll be coming to see what else we can do to take care of the child. So once the tooth has erupted, we should start to brush the teeth. So initial stages we can just take a cloth or finger brush which will be available with the soft bristles, and with just water we can just brush it. So later on we can use toothpaste which is very less fluoride, that is less than 500 ppm or up to 500 ppm of fluoride content in that toothpaste. And we can use brushes as to child's interest, like because we have to make the brushing a very playful thing for a child. We can use the brushes of various cartoon characters which the child likes, like Motu Patlu or Chota Bheem, so many. So we can use any of those so that the child enjoys brushing. And the child should be assisted in brushing till almost 5 to 7 years of age. So first we can take up to a grain size of toothpaste initially. Then after 3 years we can take up to a pea size of toothpaste in a brush. So and brush the teeth twice a day, once in the morning and once in the night. And one more thing is, we should not give more of added sugars, beverages which contains a lot of sugar in it, or sweets to the children, because this might again cause dental caries. And even if the child eats, we should rinse the mouth or we should brush the teeth immediately, so that any coated sugar which is found on the teeth would be taken out. So one more thing which I forgot to say previously, when the child is during the process of teething and the child is more irritable because of that pain, at that time we should limit the citrus food, orange or lemon and such things which contains more of citrus food, because that even might cause more pain or more irritation to the gums, and it might even make the child cry more. So that should be avoided at that time. So then the next thing which I wanted to say is about the natal teeth. Sometimes we can find this during the teeth. As soon as the child is born, the teeth might be present. This is called as the natal teeth. This is found very rarely, 1 in 2000 to 3000 children who are born, newborns who are born. It's very rare. At times, most of the times, it will be very loosely placed. So we might ask to remove that tooth, because it might cause aspiration in your children. Most of the times it will be found normally, but some of the times it might be associated with some syndromes. You do not worry about it, because all the newborns will be seen by the pediatrician, so they will be informing you about this. So other than that, if you have any other doubts pertaining to teething in children, you can leave your comments in the comment section, comment box below.